Okay, started.
Okay, thank you all for attending. This is Joanne Morgan with Art Jetter and Company, and I apologize for the delay in starting today. It was actually a user error, so thank you for your patience. Anyway, I would like to welcome you today on behalf of the senior health team here at Art Jetter and Company, and one of our direct contacts at Cigna, Michelle Bridges Smith, has agreed to present to you information on the Medicare Access and CHIP Reauthorization Act of 2015. Extremely important information as these guidelines will come into effect January 1 of 2020. So Michelle, thank you again for attending, and I will let you start presenting.
Great. I hope you guys can hear me now. So I thank you for inviting me in, and thank you for that nice introduction, Joanne. And good afternoon, everyone. Like Joanne said, I am with Cigna, and my sole role is to train. So today I'll be talking about Medicare Access CHIP Reauthorization Act of 2015, which is MACRA. And this is an important topic, as you know, because it affects plans, the Medicare plans, CNF, and also there's some other legislative initiative that's going on with MACRA. So don't be afraid to ask questions. I will do my best, to get you the information you need. And just always remember that, because the session ends, Joanne, feel free, anyone, to reach out to me directly, and I'll be happy to answer those questions. So moving on, what I wanted to do is I wanted to give you an introduction, and I'm just going to give you some background real quick. When you think of MACRA, when I attended the conference, MedSup conference last year, one of the major things the DOI mentioned is misinformation. So this information that I'm providing today will help with your conversations with your customers, and that's what we want to do. We want you to be able to answer those questions and give correct information. That was the major part of what the DOI, state DOI had said, is that this information is giving to the customers, and the customers are going to the DOI. So we want to make sure that you are in good standing with your customer always. So I want to kick it off and just talk about MACRA, because MACRA, regardless of what you're hearing, MACRA is not tied to the Affordable Care Act. It's its own initiative. So when you think of MACRA, it's a piece of a broader initiative that is bringing more value and quality to the healthcare delivery system. So the sole goal of MACRA is to change the way Medicare pays healthcare professionals. When you look at healthcare professionals today, they're paid based on the number of services they perform. And MACRA will transition that healthcare system to a model where the healthcare professionals, they will be paid based on quality of the care they provide, not the volume. So when you look at it, it's value over volume. A couple other call outs here that I wanted to talk about on this MACRA initiative. MACRA is going to prohibit first dollar on Part B coverage on MedSup plans starting on January 1st of 2020 for those that are newly eligible. And I'll get into that a couple of slides down. But what this means is that the newly eligibles will have to pay out of pocket for the Part B deductible. And so this affects MedSup plans that have the first dollar coverage, and the only plans that have that first dollar coverage are plans C and F, and we'll talk more about these plans coming up. A part of the initiative also is that the Medicare card holders, they will notice a change in their card. So they're going to be assigned a new identifier number, which is called an MBI or a Medicare Beneficiary number. that replaces the Social Security number on the card, and we'll talk a little bit more about that, and I'll give you an idea of what that new card is going to look like. Now, what I wanted to show you here, basically, when you think of MACRA, all the states have to apply. And really, this map is recent state regulatory activity efforts to amend the rules for Medicare Supplement policies. And it is here to reflect the changes made by MACRA. All the states have to apply. There's no not applying. So when you look at the implementation map, just think that these states are going to go through some changes. And when they start off, they will start off working on legislation and regulation, which is they'll start off at that orangey, and then they'll work towards proposal introduced, and then the legislation enacted. So that's the steps they have to do, and you can see that there's quite a bit purple. That means those states have enacted MACRA. You have some states that's staggering behind in yellow, but they will go through that stage. They will turn green, and then it will turn purple. And that's what I wanted to give to you today, is to let you know that every state has to comply. There's no ifs and buts about it. Some states are quicker than others. So while I'm getting back to MACRA, I just gave you the basic information, what MACRA stands for. So what I want to do is I want to talk about who does it affect. Basically, there are three buckets of people that will be affected by MACRA. And the first bucket are those that are newly eligible. And the definition of newly eligible is highlighted here on the slide. But that's anyone who's turning 65 on or after January 1st of 2020. Also, anyone who's eligible for Medicare Part A benefits due to age or disability on or after January 1st of 2020. And I want to call out for those individuals that will reach age 65 before January 1st of 2020, but who, will not be entitled to Medicare Part A until after January 1st of 2020. They would not be considered newly eligible. They will be considered grandfathered. And I'll talk about grandfathered a little bit more on this slide. But when you think of grandfathered, those are the individuals that will be turning 65 before. So again, I'll talk about that on the next slide a little bit more. So the next thing are the carriers. So all the carriers have to make sure their materials, their system, the coding engine changes have to be made in order to allow for those grandfathered and those newly eligible. And when you look at carriers like Cigna supplemental benefits, and we offer Medicare Supplement plans, right? So we will have to do some plan redesign because Plan C and Plan F will no longer have that first dollar Part B coverage for newly eligible. And then when you think about the waiver states, there are three waiver states. There's Minnesota, Massachusetts, and Wisconsin. And they don't necessarily follow the same naming convention or plan convention as the other states because they have their own equivalent. They still have to comply. They're not exempt. Their equivalent plan that they come up with would have to eliminate the first dollar Part B coverage. All right, so let's talk about plan impacts. I mentioned on the last slide that MACRA is going to prohibit first dollar coverage on Medicare supplement plans that provide Part B deductible coverage. And the first dollar coverage is an insurance policy that pays healthcare costs beginning with the first service. And Plan C and F are the only plans that have the first dollar coverage. And let me just give you a little background. So The reason why MACRA was signed into place is because there's a link between having this coverage and using more healthcare services. For example, someone with first dollar coverage, they might choose to go to the emergency room for non-emergency issue rather than wait and see their physician. So really, when they look at the cost, that was a way to say, okay, no one's getting Part D deductible coverage, for those newly eligible. We have to stop it at somewhere. And so, in essence, some people ruin it for others. And so this case, they realize that, for those small things, those costs add up. So again, Plan C and F cannot be sold to newly eligible. And I just want to call out on that grandfather status again. So for those who are Medicare eligible prior to January 1st of 2020, or will be turning 65 prior to 1/1 of 2020, they may not have decided to take Medicare. They may be still looking, or maybe they're on employer benefits, and then they decide they're going to retire. They still can get Plan C or F because they are grandfathered. They are eligible to purchase a Plan C or a Plan F. So keep that in mind when you're talking about it. Now, if a customer turns 65 or qualify after 1/1 of 2020, they cannot get a C or F plan. Now, here's an example. Let's say you have a customer that's turning 65 on January 26th of 2020. They still cannot get the C or F plan because their birth date falls after 1/1 of 2020. Those customers can't get the equivalent that does not have the Part B deductible. The equivalent to a C is a Plan D, and the equivalent to a Plan F is a Plan G. Now, here's another scenario. Now, if you sell 6 months early, and remember that, yes, customers can apply early, but that doesn't mean they're going to get the C and F plan. It goes by definition if they're newly eligible or not. And since their birthday falls after 1/1 of 2020, they turn 65, they cannot get a C or F plan. They would get the equivalent, which is a D or G, although they can apply and be sold 6 months prior. So just keep in mind when you think about this and you're looking at the chart, the only difference between a C and an F and a D and a G is the coverage of the Part B deductible under the Plan C and F. All of the benefits are exactly the same. And remember, when you're having conversations, and it's going to get heavy because customers are going to be calling in and they're going to say, oh, my C, I can't get my C or I can't get my F. If they're in them today, they can continue to get the C and F plan because they are grandfathered. It's just the newly eligible that cannot get a C and F plan. And I really wanted to explode that because customers will call in and they'll say, my C and F is going away. No, if you're in them today, you can continue to get them after January 1st of 2020. So I hope I was clear on that. And basically here I wanted to show you the new plan structure chart, and that is exactly what I just mentioned on the last slide. So looking at this chart in columns D and G, scroll down to the Medicare Part B deductible, and I think it's the fourth one from the bottom, and you will see that the Part B deductible is no longer checked because they cannot get it. Then if you do the comparison, you move all the way to the far right under Plan C and F. Those are for customers that are eligible prior to 1/1 of 2020. They do have the C and F plans available to them. And then when you compare these plans, you can see all of the benefits are the same, right? It's just that Part B deductible is not checked for D&G, but it is checked for the C and F plans. All right, so here I wanted to address the penalty and fines, because of course there are penalty and fines, right, if we don't follow any type of legislation. So these are important because we have partners that sell our mix-up plans, and these partners have to make sure that they're filtering logic, just like Cigna supplemental benefits have to make sure that our filtering logic does allow a newly eligible to purchase a plan that they are eligible to buy. So when you think of these newly eligible, so think of it like this. If a newly eligible who is new to Medicare, that customer cannot buy or be presented with a quote that has a plan C or F in it. They will not see it, and they should not see it. Now, if you had another customer that was not a newly eligible, but they was one of those grandfather persons that I talked about, then the customer can buy and be presented with a quote for Plan C or Plan F. And I just want to remind you that there are hefty penalties if the customer who is newly eligible is presented with a C or F plan. And here's some FAQs. As you recall, I shared with you earlier about the plan changes, and here's some FAQs pertaining to today's topic. Get you a chance to look at those. It's exactly what I just explained. So here's an example of how the new Medicare card design looks like. Everyone will get a new card. The mailing of the new Medicare card started in April of 2018, and it will continue through April 2019. So looking at this sample card on this slide, you notice that Social Security is no longer an identifier number on the card. And then note that the Social Security has been replaced with a randomly assigned beneficiary identifier number. So when customers get their new card, they don't have to call us. They don't have to call you. They just need to provide that new card to their doctor visit. At their doctor visit, right? And the reason why they're moving away from the Social Security numbers on the Social Security card, and in thinking that this will mitigate fraud and identity theft for our seniors. Now, you might get questions about claims that were submitted under the Social Security number, and that's a good question if there's someone who's asking that question. So there is a transition period for providers, and it started last April 1st of 2018, and it will run through December 31st, where CMS will accept the HICN number or the new MBI number when submitting data to the agency. So we definitely want to give you a heads up on that if customers are calling about their new Medicare card. And here's some FAQs on the new Medicare card. Again, I just explained the MBI number. It's a random number, and it has, 11 digits, 11 characters and numbers, and there's no special characters or there's no rhyme and reason for it. And here's the mailing. I wanted to show you the Medicare card. So you can see where CMS started to mail the cards out, and then they were mailed out in waves. And the last wave is 7, right? So they began mailing in October, and that should be completed by April of 2019. So if someone say, hey, my sister is in Illinois and she got a card and I didn't get my card, I'm in Louisiana, well, their sister, right, was in wave 3, and they're in wave 7. Everyone will get one, but again, it was mailed out in waves, those new Medicare cards. And here are some FAQs about the new Medicare card. Again, there's no rhyme or reason why the digits are different in terms of the mailing. The Medicare ID card is just to keep this information in your back pocket. And then here's some 2 customer flyers and inserts that Cigna had took a proactive approach to include in the welcome kits and the explanation of benefits for customers. And again, we started this effort in April of 2018, and we will continue through April of 2019. So again, CSB has proactively inserted these flyers for our customers. We give them some information as well. And here we are with a recap of this session. So let's just recap what I talked about in this session. When you think of MACRA goes into effect of January 1st of 2020. Be sure you have a clear understanding of the definition of newly eligible, which is anyone who's turning 65 on or after January 1st of 2020, and anyone who's eligible for Medicare benefits due to age or disability on or after January 1st of 2020. Remember, I said it goes by definition. When you think of customers, if you're turning 65 after January 1st of 2020, you are considered a newly eligible. It doesn't matter if you're eligible for Medicare on, November of 2019. If you're turning 65, it goes by definition. On January 1st or after January 1st, you are considered newly eligible. If you turn 65 prior to January 1st, then you're considered grandfathered, and those C and F plans will be made available to you. So I just want to talk about, this chart again. So the plan changes are effective January 1st of 2020 to standardized Medigap plan. And this just tells you that Plan C is going to be redesignated as Plan D, which does not provide the Part B deductible. And Plan F is going to be redesignated as Plan G, which does not provide the coverage for the Part B deductible, and so forth and so on with the Plan F with the high deductible is going to be redesignated as Plan G with a high deductible, which does not have that plan to provide that coverage for the Part B deductible as well. And so just keep in mind a review of the cards that the Social Security numbers will be removed and replaced with the randomly assigned Medicare Beneficiary Number, or the MBI. I always default to MACRA. When I say MBI, I try to use MBI, but I know some folks don't like acronyms. So this is the Medicare Beneficiary Identifier Number, and this transition will begin on April in 2018, and it continued through 2019. So when you think about the effect of this provision, as of this date, it is that the newly eligible Medicare beneficiary will be required to pay out of pocket for Medicare Part B deductible. And just remember that those that are newly eligible customers, they can no longer have the Part B deductible coverage. And here I wanted to go through just to let you know what Cigna has been doing in terms of MACRA business. So right now, we have redesigned our outline of coverage. We are in the process of filing them with the states. So we're right on target. When you think about the systems, Cigna has already started implementing where we will accept the new NBI number, right, or the HICN number. So those systems have been updated, and I believe, the end of December is when we finalize that. We're still working on pricing, so we're still not there, but I can tell you the outline of coverages is pretty, we're on target with that. And then we look to quarter to maybe the end or the end of quarter one, the state is going out to the state approvals with those outline of coverages that we have finalized and the pricings that we have finalized and the plan we designed. So I think we're pretty much on target and for I want to say a July implementation. So I think with Cigna is pretty much on target. And I just want to give you a bird's eye of what is going on in our shop. Here are some additional resources. I encourage you to go out and use these links to, gather more information if you have questions, but some quick links to this information. And so that concludes my overview. And I want to thank you. And Joanne, if you're there, I'm going to look in the chat and see if there's any questions.
Yes, I do see one question for you, Michelle. Okay. You may have answered it, though.
That's okay.
Do you see there? Can you read the question?
I don't see it. Nope.
Okay, it says, why is HDF going away since the client would be paying the deductible?
Why is the what is going away?
The HDF for the high deductible F going away. So in other words, the way I understood it is why is the Plan F high deductible F is going away, but they're making the Plan G a high deductible F.
Right. So keep in mind that the high deductible plan is not going away for those that are grandfathered. For those that are newly eligible, the Part B deductible will not be available to them. So it has to be redesignated for those newly eligible. And that's what you see when you look at the redesignated plan, that Plan F high deductible is now going to be a Plan G high deductible. And that the only difference is removing that Part B is because those newly eligible Medicare beneficiaries cannot be presented with the Part B deductible.
Okay.
You follow me? Did I answer that question?
And we can go ahead.
Okay. No. So I just want to be clear on that. So when you think about Plan C, Plan F, and the Plan F high deductible, that is not going away for those grandfathered. Remember I talked about the Plan D and G and the high deductible G. That's for those newly eligible because they cannot be presented with a Part B deductible. They're now going to pay out of pocket for that Part B deductible.
Okay. All right. Well, and we will get with the agent that asked these questions to make sure that we're meeting her needs.
Okay.
I do have one question as other people are thinking of questions. Is there an actual end date of implementation that the guidelines are imposing on the states, or is this just throughout 2019 or 2020?
So that's a good question. So everyone will have to apply, right? Every state, there's no exceptions. When you look at the states have to be ready and set to go by January 1st of 2020. Because they're going to be out of compliance, and there are going to be some hefty fines if a customer at a carrier say, well, we want to be able to purchase a plan C. You can't see a C if you're newly eligible. There has to be a D and a G. And so all the systems are going to have to be redesigned. There are going to be plan redesigns that's going on. They cannot be presented. They can't even see it. If they're presented and they're able to see it, there's going to be fines that's going to be imposed. So the states have to comply. They don't have a choice. You have states like, there was one state, North Carolina, that's, in South Carolina, that's really, lagging and saying, hey, we're going to do it, but we don't like to do it. And so they're really trying to fight the fight, but there's no fight, right? You're going to have to do it, because if folks in North Carolina, South Carolina that are newly eligible and they're able to purchase a C and F, that's going to be a problem.
Okay. Okay, well, I believe so, yes. Are there any other questions from the audience? Well, we would like to share that if you do have questions now or after today and throughout the year, we are here to answer any of your questions or at least direct you. The seniorhealth@jetter.com. We do have our email up, and of course our phone number is available to you. Plus, if you recall, we do offer all lines of insurance here, and we have specialists in the office that can assist you, along with numerous benefits that we provide to agents that we work with. So please feel free to call us at any time. And then once again, I would like to extend our thanks to Michelle for taking time out today to answer these questions and provide us with this education. And I'm sure we will have many more questions as we go throughout the year. So thank you all for attending. We greatly appreciate your time. Bye now.
Thank you.
Thank you, Michelle.